Good morning to all our viewers. Today I'm joined by a group of health professionals, doctors from the Australian Sri Lankan medical aid team. With me is the president, Dr. Irosha Premaratne, and also Dr. Koshala Rupasar. Irosha, if you could please tell us a little bit about the Australian medical aid team and what the recent activities are.
Sure. Thank you, Sid. So, AUSLMAT, as most of you would know, was initiated by Dr. Quintus De Silva, who's a cardiologist in Melbourne, back in 2004, soon after the Boxing Day tsunami that affected Sri Lanka. So, since then, we have been providing the health sector, the public health sector in Sri Lanka in various ways. And probably we've been to Sri Lanka with various medical teams 29 times now, and raised funds and sent medicines and medical equipment for close to 10 million Australian dollars. So most recently, as you probably heard, we had the Heal Our Nation fundraising program during the recent financial crisis that affected Sri Lanka quite badly, especially the public health system. So with all your support, actually we raised over 250,000 consecutively for 2 years, so over $500,000, and all the money was spent on actual purchases without hardly any overhead costs or administrative costs, and they all were distributed to over 26 hospitals all across all areas of Sri Lanka.
Great, that's some significant amount of work that you and the team has done so far. Now I've been told there are some projects underway. Could you please share a little bit more about those projects that are underway?
Sure. So as you know, the health crisis continues and the needs are very many. So we were in Sri Lanka in July on our most recent medical mission, and there were quite a few critical needs that were identified. Mainly, we thought we'll focus on the pediatric or issues that affect young children or newborns. So there's a very remote hospital in the eastern province called Dehiattakandia, and they desperately need a neonatal unit. The hospital has a large maternity ward, but they don't have the basic equipment to resuscitate the newborn babies and end up losing lives. So the stories we heard were very, very sad, really. So our highest priority is to get some basic, like ventilators, incubators, infant warmers, etc. for this hospital. There are also many other requests. The Sirimavo Hospital in Peradeniya is one of the two pediatric hospitals in Sri Lanka, and their cardiology unit needs quite a few heart-related equipment. And then also there is a recent development of a project for it's called Lama Piasa, which is it's a rehabilitation service for young children affected by domestic violence. So these are the areas that we are focusing on at the present time and trying to raise funds.
Thank you. To me, all of these projects sounds equally important and comes with a great priority. Now, Koshala, if someone wants to contribute, how can they do this?
First of all, I'd like to thank the Australian community for continuing supporting our AUSLMAT for last nearly 20 years now, and with that help we managed to do a lot of work towards saving innocent lives in Sri Lanka. And if anybody like to contribute for this our programs, there are a few ways. One, directly you can when you get into our website auslamat.org, and you can see a pay button there, so you can when you link that, it directly go into our account, and then you can contribute through that. And either you can contribute to our main fund, or if you decide that you want to contribute for one of these projects that we are doing in one particular project, you can just mention this is a project I like to contribute in our your description part, and then we can make sure that your money goes to that particular project. And the other way is some employers have what called this employer matching program, where when you contribute, your employer will match the same amount, so that double up your donations. So if you contact your employer, they have an employer matching program. That's one way of supporting us. The other one is if you refinancing your home loan or buying a new house. There's a home loan, certain banks link with us to support for that, and their commission, part of their commission, they are happy to donate to us. So it doesn't affect the person who is buying the loan. Their buying amount or their interest rate doesn't change, but the normal commission that normally allocate for the agent, few of our agent happy to donate part of that to us. So if you have, if you decide to do that, then you can contact us. We can connect you with one of our agents who are doing that. Those are the main three ways of donating. In addition to that, if certain organization or you personally like to contribute for a certain part of our project, for example, that as Hirosha said, our premature baby unit we are building in Dehiyata Kandiya, they need a lot of equipment, baby warmers and incubators and things like that. So if you happy to participate as an organization to part of that, to buy one equipment, for example, it doesn't need to go under AUSLMAT. It can go under your OBA or GA or your organization name, and we're happy to involve your support for that as well.
Thanks, Kaushala. And what about the upcoming fundraiser?
Yes, there's a fundraising event happening 2nd of March in next year at Hungarian Hall, and it's a medical expo. It's a new event with all the doctors coming to talk to people. You can contact us to get to support us or get more details about that, about this event.
Thank you very much, Hirosha and Kaushala.
Thank you, Morning Show, for giving us this opportunity to come and talk to you today.
Thank you.